So there are actually latex dental dams and non-latex dental dams in the market, I believe, to cater for those who are allergic to latex. So Dr. Filippo, what is your opinion about latex allergy?
So fortunately, the dental allergy is not so common, but it's something really important that we cannot underestimate. So we have to pay attention. So we know that generally the allergy to the rubber latex is detected after some exposition to the material. So often the patient already knows about its allergy when he comes in our office for the first time, and generally something the first thing that say, I'm allergic to latex, so please pay attention. But in any case, it's something that we have to investigate if it's a new patient during the anamnesis, no? So we know that most of the allergic people belong to category that are strict contact with the latex. So employed on factory that are working with the rubber, or even nurse and doctors. So regarding the allergic reaction, we know that there are three types of reaction. The first one is not an immunological reaction, is an irritative dermatitis, and is more linked to the powder we can find on the gloves, we can find on the rubber dam sheet. That's why there are gloves and rubber dam sheet powder free. So the problem is not the latex, is the powder, are the components used during the production of the gloves or of the rubber dam sheet. The second type of reaction is a type 4 hypersensitivity. This is an immunological response, but is late and a localized reaction. So it means it is not on the chair while you are working. So after 48, 96 hours, the patients come back saying, okay, I have like erythema or bubbles similar to irritative dermatitis. So it's something that is not immediately on the chair. And then there is the third one that is the most tragic, is the type 1 hypersensitivity. Fortunately, is rare and is an immediate reaction. So it's on the chair, unfortunately, and is modulated by IgE. So its symptom can range from just a local sign or laryngeal swelling, palpitation, bronchospasm, or you can have a reduction on blood pressure, until the most tragic, that is the anaphylaxis. Okay. So in this kind of patients, we do follow, of course, latex-free procedures. So we do use latex-free gloves. We do use latex-free dam, definitely. And this is the only difference we have to follow. Please consider that in the anamnesis, the people that got a surgery in the hospital, 2 surgery in the first year of life, are considered at risk to develop a latex allergy. What I try to do is to treat the patients as a first of the day, because some years ago, one of them, when arrived in the office, they started to have some respiratory difficulty, but just in the waiting room, no, because when you remove gloves, there is powder in the hair, and on the powder you can have latex allergen. So probably, I don't know if it was something real or something more emotive from the patients, but my suggestion is try to treat as first appointment. So the office is completely latex free from the day before. So it's okay and no problem. And honestly speaking, working with rubber dam gloves is not so comfortable to me. And even with latex-free rubber dam in the past was not easy. But now there is a very interesting latex dam-free, and this is the purple one from the company Suntory, that you cannot understand, that honestly speaking, you cannot understand if the sheet is with latex or without latex. So there is the same elasticity, the same resilience on the sheet. This is something really important for a proper application. So I think that now in my practice, it remains only the problem of the gloves. And honestly speaking, in the past, as was so difficult to me to work with latex-free rubber dam, what happened is, okay, I buy the box latex-free, and then the box is away from me, and at the next use it was expired always. Now there is no more this problem because this one is really good. So I have the box, and then I can use even during the normal practice. So because the properties are really, really good and really, really close to the normal sheet. So it's a good point.
So like, as what you said from the past, the non-latex rubber dam are actually not as good as the latex rubber dam, is it?
Yes, because I don't know, it was elastomer. So when you the risk is during the application to tear too much the sheet, and then the hole you created remains too big. So with not good leakage control. Now that this problem there is not anymore, thanks to this new latex free. So it's really similar. The resilience is a characteristic, and the elasticity as well is a characteristic really important. So that's something that we have to know about the rubber dam in order to use properly this tool. So every time the elasticity is not good, you risk to get a scratch of the sheet. And when the resilience is not good, the risk is that after the stress for the application of the dam around the tooth, the sheet doesn't come back to the original shape, but is not. So there is a lot of space between the tooth and the edge of the hole. So you have leakage that then you have to control. So you have a problem that you can control, but the less problem you have to control, the better it is for your practice. So that's why for me it is really important nowadays when it comes to patients with latex allergy to have this kind of rubber dam that is basically similar on properties to the one with latex.